Hello, my name is Mackenzie Pirtle, and today I'm going to talk about telehealth. What is telehealth? Telehealth is the use of technology to engage in care for patients between face-to-face visits and can also reduce the need for encounters. Patients can use technology including phones, tablets, and laptops. So, for example, if a patient has a cold or needs medication changed after a recent visit, the patient can simply do a sort of FaceTime with their physician and nurse and can have their prescriptions changed or something newly prescribed. How telehealth can be used in healthcare. There are many ways that telehealth can be used in healthcare, such as faster referrals from patients to specialists by not having to wait for an appointment time, educating patients on different ways to manage their symptoms, especially by being able to better assess the environment in which they live, outpatient monitoring of patients' oxygen levels, heart rate, respirations, and blood glucose levels, pre-surgical and post-surgical care by having a nurse visit with the client about how they can better prepare themselves for surgery and how to better take care of themselves if something were to happen post-surgically. Assisting doctors in reducing patient workloads by having the assessment already done and charted before the doctor visits with the client. Supporting medical response teams in bringing patients to the hospital by the nurse being able to get a better assessment of seeing and speaking with the members of the household before bringing a client into the hospital. Some benefits of telehealth include primary care and chronic condition management by having a better preventative health and ongoing health treatment regimen, by the patient not having to wait for appointments and having better preventative health by having easier access to speak with a nurse or physician. A better assessment. This means that the nurse or physician can see the environment in which the client lives. This will help better assess why a client may have sniffles or may be having a certain kind of side effect or issue with their condition. Control of infectious illness. This is safer for not only other clients out in the public, but also for the staff members in an office or healthcare setting by allowing an infectious disease to not spread by the patient simply staying at home. Comfort and convenience is mostly for the patient being able to stay at home and not have to drive the unknown amount of hours and minutes to the office, as well as the nurse. So if a nurse were to say, let's say, have a disability, they could stay home and work from home just as many people did during COVID. Some risk. Telehealth does have a lot of risk, and this is something that is going to be advanced in the future, hopefully, by regulations. By this, I mean patient-provider relationships are at risk. For the lack of face-to-face communication, there seems to be something lost, and this was discussed by the Jarawala and Poloski article in 2020, that patients felt that they didn't have as much trust in their physician and nurse because they didn't have that face-to-face interaction. There's data accuracy and misdiagnosis is always a risk by not being able to fully see and interpret the complete body language of a patient as you discuss things, since communication is 70% of our communication. Patient privacy and confidentiality. As technology becomes more advanced, hacking and bugs and viruses in computers is always a risk when discussing and prescribing medications for clients. Lack of multi-state telehealth licensure and medical liability is always a risk, and that is something that hopefully lawmakers will look into in the future. Fraud and abuse. If a patient does not know their prescribing provider, how are we sure that they actually have a medical license? That is always something that patients need to look out for. And prescribing of controlled substances. According to the sources listed on the slide, there is no regulation on the type of prescription a physician can make over telehealth. So it can be concerning that a patient can say the right things and do the right stuff, and they can be prescribed a controlled substance when not necessary. This is why our assessments are so important. So how does telehealth aid in safety and efficiency? Well, according to O'Malley and all of his other sources in 2022, nursing care is 3 times more efficient than a regular nurse in a physician's office or like healthcare setting. This is simply because a nurse is not getting up and running around to get all resources, going from room to room. Instead, they are logging on, documenting, and moving on to the next patient. Very efficient. The patient does not need to travel to appointments. This aids in safety, so the patient doesn't have the risk of getting in a car accident on their way to an appointment, as well as it serves the patient as efficiency for using less time in their day to seek healthcare. There's a lower amount of missed appointments. Since everybody has a phone nowadays, it is much easier for them to log on and speak with a physician instead of having to obtain a vehicle or some mode of transportation to get to an appointment. And reducing delays in care by having more easily available appointments instead of having to wait weeks, if not months, to speak with a provider about a certain issue. Cost analysis. Telehealth reduced patient costs on average by $11,472 a year, according to Padula et al. In 2021. So this means that it is including transportation cost, patient fees, insurance fees, all of the things that patients pay for within a year for healthcare reasons. I've even seen co-pays being, sevenfold less. Instead of $30, they are under $10 to see a physician. There's 87% fewer hospitalizations due to better preventative health and easier access to a physician when needed. Instead of running to an ER, they can easily log on and talk to somebody in their primary care provider's office. 77% fewer deaths among patients with access to remote telehealth technology, simply because they have better access to healthcare needs and can discuss such issues with their primary provider instead of waiting and going to the emergency room when it is the last minute. Legal aspects. The issue with telehealth is that there is not a lot of legal regulation on the local all the way up to the federal level. The only thing I could really find on legal aspects of telehealth was the Federation of State Medical Boards created the Interstate Medical Licensure Compact to ease the portability of licensure between the practice of telemedicine from state to state for physicians and PAs. But this does not apply to nurse practitioners because they are licensed under a nursing board, not a medical board. So if you're an NP, it would depend on the state in which they live in to how this compact would affect them. As to nurses, I really could not find anything legally that would impact our nursing care other than if there were to be some sort of fraud or abuse. Virtual telehealth nursing jobs. So nurses, of course, can work in a variety of healthcare settings, but in telehealth, we can work from physicians' offices, hospitals, trauma centers, crisis hotlines, outpatient care facilities, and even poison control centers. So this opens up the job market for nurses. Telehealth impacting nursing jobs. As I said before, there's a variety of settings. This created a projected 194,500 average annual openings expected in the next 10 years by the U.S. Bureau of Labor Statistics. This was only last year. Employment is projected to grow by 9%, which with a shortage of nurses, this can be encouraging for nurses with disability or nurses that are getting burnt out in their current job to work with more comfort at home doing the same nursing job that they love. In conclusion, telehealth is the use of technology to engage in the care for patients between face-to-face visits and can also reduce the need for encounters. There are many benefits and risks to telehealth, in which the future hopefully will ease the amount of risk and increase the amount of benefits. Aid in efficiency and safety of patient care by enabling patients to have better access to their physician, as well as reducing the workload of nurses per patient so that we can see more patients per day. Cost analysis, meaning that there is less money spent by the patient, hopefully motivating the patient to seek better health care. Legal aspects, hopefully in the future we will have better legal regulation on telehealth to avoid such risky situations, and used in a variety of settings for nurses, so increasing our nursing demand, which will help the future of nursing grow into a better culture. These are my references, and these are my picture references. Have a nice day.